everyone. I am Dr. Vidya, working as a consultant in Pediatric Ophthalmology Department, Sankara Hospital, Bangalore. To commemorate the International Day of Persons with Disabilities, we have curated this lecture series to promote the understanding of the visual disability issues, to better evaluate them, to have the better treatment options and the challenges involved. Now we have Dr. Praveen Vashisht with us to share the insights on the visual impairment in India, the perspective. Dr. Praveen Vashisht is the officer in charge of community ophthalmology at RP Center, the Apex Ophthalmic Institute in our country. Dr. Praveen has been instrumental in developing models for the community outreach services and strengthening the epidemiological research and training in the field of community eye care. He was appointed as the Principal Investigator for the National Blindness Survey 2015 to 2019 and the National Trachoma Survey 2014 to 2017 GT-only survey in 200 districts of the country in partnership with Tropical Data and the WHO. He was appointed by WHO as a member of Dossier Review Committee for elimination of trachoma in Nepal and Myanmar. Dr. Praveen has been involved in blindness control and rehabilitation services with WHO SEARO and coordinating the activities of WHO Collaborative Center for Prevention of Blindness at RP Center AIIMS. He is also the Vice President and the key resource person for Vision 2020 Right to Sight India. He has more than 100 publications in international and national peer-reviewed journals. Over to you, sir.
Thank you, Dr. Vidya, for this nice introduction. I really thank Sankara Academy of Vision for inviting me on this special day, that International Day for the Disabled. And I'll be sharing my slides. I'll be talking about blindness and visual impairment in India, the current prevalence and the key causes. And I hope my slides are visible.
Yes, sir, it's visible, sir.
Sure. So in fact, before going to the details, first thing we should know that what is the definition of blindness? And a layperson feels blindness means there is absolute loss of vision, but actually the definition is different from that. And if a person is not able to see this, the topmost line from a distance of 3 meters, that is the visual acuity is less than 3/60 in the better eye with available correction. So whatever the person is using, if he's using spectacles, it is with spectacles, not using spectacles, without spectacles. This is the definition of blindness. And currently India as well as WHO, they use the same definition, that is visual acuity less than 3/60 in the better eye. As far as visual impairment, or in Hindi you call it the Alpdrishti, it is a slightly better vision, where if the visual acuity is less than 6/18 in the better eye with available correction. So 6/18 in the Snellen's chart is the 4th line. If the person is not able to read this line by both his eyes, then the person is labeled as visually impaired. And it is from the distance of 6 meters. So what are the targets for reduction of blindness in our country as well as WHO? As far as NPCB and visual VI program is concerned, the target is to reduce the prevalence of blindness to less than 0.3% by the year 2020. And currently it has been extended to 0.25% by the year 2025. Whereas WHO, as part of Global Action Plan, which was there from 2014 to 2019 for achieving universal eye health coverage, and their target was to reduce the prevalence of avoidable visual impairment by 25% by the year 2019, and was compared to the baseline prevalence of 2010. In fact, WHO, they gave figures for blindness and visual impairment for various countries for the year 2010 and expected them to reduce it to by 25% by the year 2019. We conducted this National Blindness and Visual Impairment Survey from 2015 to 2019. And this was, in fact, the report was released by Honorable Health Minister at that time. And this survey was conducted nearly 93,000 population and it was covered in 50+ age group. And as per this survey, there are different categories have been defined, but for people, probably the most important figure is the prevalence of blindness, which was 1.99% in 50+ age group, whereas the prevalence of visual impairment was 13.76%, and again in the 50+ age group. So these are the two key figures. And if I had to see the trends of prevalence of blindness, in 2001 national survey, we had a prevalence of blindness in 50+ population as 5.3%. In 2007, we had another national survey. As per that survey, it was 3.6%, whereas now, as per this survey, further reduced down to 1.99%. So we can say year passing on. But one important thing service, or there are some other reasons, and we need to work in this area for providing services mainly to the female population. As far as age is concerned, blindness is age-related phenomena. It was expected that, like in 50 to 59 age group, the prevalence was just 0.5%, whereas when going to 80+ age group, it was 11.6%. And we have also seen the difference as per rural and urban area. We see that we have 70% rural population, but 70% services are available in urban areas. And you can see the gap here. In rural area, the prevalence of blindness in 50+ age group was 2.14%. In urban area, it was 1.8%. Another important aspect, its association with literacy. Among illiterate people, the prevalence was as high as 3.23%, and you can see it reduced to 0.43% in individuals who are 10th pass and above. So it is associated with illiteracy and rural population. And this is the variations of blindness figures in our country in various districts. As you can see that it is ranging between 1.08% in Kerala, Thrissur district, where survey was conducted, and in Bijnor, where it is 3.67% in UP. So this is all variation, an average of 1.99% in our country. And in fact, the survey was conducted in 50+ population, but the government expects that we should have figures for the entire population. So we conducted another survey in 0 to 49 age group. And based on that, we extrapolated figures of blindness and visual impairment for the entire population in country. And as per these surveys, the prevalence of blindness in overall population is 0.36%, whereas prevalence of visual impairment in overall population is 2.55%. So, and this is the probably important slide. And in 2010, the WHO gave us figures for blindness and visual impairment as 0.68% and 5.3% for our country. And you can see by the year 2019, when we finished this survey, we got a figure of blindness as 0.36% and figure of visual impairment as 2.55%. So instead of a target of 25% reduction, we have shown that we have reduced our visual impairment by 51.9%. So it's a huge achievement for our country that we're able to show globally that the visual impairment is significantly reduced against the target of 25%. This figure shows the trends of overall blindness in country in last 40 years. National Program for Control of Blindness was started way back in 1976. And at that time, as per ICMR, Indian Council of Medical Research, the prevalence of blindness was 1.38%. Even at that time, the targets were there for the year 2000, it was 0.3%. In 1986-89, the WHO did the midterm evaluation of the program. And you can see as per that survey, instead of reduction in prevalence of blindness, there is increase in blindness to 1.49%. Then 2001, it's another national survey was conducted, and there was significant reduction from 1.49% to 1.1%. 2007 survey showed 1%, and the current survey is showing the prevalence of blindness is 0.36%. But there's a catch till this point, till 2017, the definition of blindness was the presenting visual acuity less than 6/60. But for this survey, the definition was it is less than 3/60. So against a target of 0.3%, we have got a figure of 0.36% under NPCB, National Program for Control of Blindness. Then another important issue is what are the various causes of blindness in our country. Just for information, cataract is the leading cause of blindness at present. Even in 2001, it was also the leading cause, and it is nearly responsible for 2/3 of blindness in our country. Exactly 66.2% of blindness is due to cataract. The second leading cause at this stage in our country is the corneal opacity, which include the non-trachomatous corneal opacity, responsible for 7.4% blindness, and trachomatous corneal opacity, just 0.8% of blindness. The major change is that in 2001 survey, it was responsible for just 0.9% of blindness, but now it is responsible for more than 8% of blindness. The third leading cause, and which is really worrisome, is the cataract surgical complications. Currently, we are doing 65 lakh surgeries in our country, cataract surgeries per year. And unfortunately, the quality of cataract surgery is an important aspect, and 7.2% of blindness is due to complications or other factors which are responsible for reduced vision after cataract surgery. That may be comorbidities, it can be refractive errors, but it is a significant cause responsible for 7.2% of blindness. Other important causes are glaucoma and the posterior segment disease, which are 5.9% and 5.5%. Diabetic retinopathy, which we were thinking that it will emerge as important cause of blindness and visual impairment, but even at this stage, it is responsible for just 1.2% of blindness. Another aspect which I would like to share, in 2001, refractive error was the second leading cause, which was responsible for 19.7% of blindness. But at present, we have found that it is just 0.1% of blindness. This may be because there is change in definition of refractive error, and it is defined when the visual acuity is reduced to 6/12 after correction. Only then we can write diagnosis as refractive error. So it is just 0.1% of blindness due to refractive error. Now, another important aspect, what proportion of blindness is avoidable, that is either preventable or treatable. It is surprising that though we have reduced the prevalence of blindness significantly, but still nearly 93% of blindness is avoidable in our country. Just 7% of blindness is not avoidable. When we talk about visual impairment, it is further only 4%, 3.84% of the visual impairment is unavoidable. Rest 96% is avoidable. So you can understand that we need to improve the service in our country so that we can reduce the avoidable cause of blindness, whether it is cataract surgery, whether it is a keratoplasty for corneal blindness, or it is quality of cataract surgery or glaucoma or something. So all these factors are actually needed in our country so that we can improve we can reduce the prevalence of blindness by acting upon avoidable causes of blindness. So overall, if we see based on this survey, the key disease which are needed for eye care in our country is the uncorrected cataract and cataract surgical complications. This is number one. So more than 70% of blindness or visual impairment due to this cause. The second is corneal blindness. Third is glaucoma. The fourth is posterior segment disease, including diabetic retinopathy. And last, refractive error, not for blindness, but is important cause of visual impairment in our country. So we have to, in national program, even in all our programs, we have to give emphasis on these diseases. I would like to inform that we have this India Vision Atlas, and the website is www.indiavisionatlas.npcb.aims.com. And in this Vision Atlas, we have information about entire data in the form of maps, tables, graph, and any person who want to see the survey findings in details, they can go through Vision Atlas and see all the figures in this Vision Atlas. Thank you. Thank you very much. Thank you. Thank you. Thank you very much. Thank you.
Thank you, sir. Thank you for this wonderful session. You took us through the magnitude of this problem in our country. Thank you, sir. Thank you.
Thank you very much.